Okay, thank you. We would like to share with you, I'm speaking in the voice of the Israeli nurses, the Israeli critical care nurses. And this is a picture of my hospital. And this is a picture of the lobby inside our hospital, which is a level 1 trauma hospital in Jerusalem, Israel. So nurses, we're at the bedside 24 hours, 7 days a week. And in previous outbreaks, nurses have had the highest level of occupational stress, resulting in moral distress, much more compared to other groups of healthcare workers. And in order to ensure our own psychological well-being, we need a layered response, which means there are different components at different times that we need in order to keep our resilience. So in order to keep ourselves strong, we need to combine different strategies aimed at preventing distress and psychological moral distress, all the way to the end to treatment and strategies and actions at different levels, from the level of our organization to our own team members, and those that are aimed for individual self-care and peer support. We need to prioritize our own well-being as much as possible, and we need to pay attention to meeting our essential needs, like even for having breaks and drinking and going out of the COVID-19 to rest and go to the bathroom, and having enough sleep and have enough time in between our shifts to build our rest and break. And we need to, it's important for us to acknowledge that we have had many successes and not just dwell on all our patients who've died. We need a good place to rest with guaranteed food, and we need psychological counselors at regular visits. So resilience is a collective organizational responsibility, and it's more related to the bonds between our own team members than the psychological makeup or coping styles of any one nurse. So if we have clear, regular, honest communication is a key to ensuring psychological well-being and safety. And we need to get through this unprecedented situation.
Julie, Julie, you have to go through your presentation, I think.
I'm moving it. I can see that I'm on slide number 4.
No, we only see slide number 1.
Okay, I'm going to stop share and I'm going to try it again.
Well, I do know how that works because I'm not really into the presentation as well. And then sometimes I'm already finishing and then the presentation is only on slide 1. So if you, you have to do it like this, I guess. Yes.
Okay, so then I can't be in a presentation mode because then it doesn't
I think as well for Eva as for you, we can say it is a Zoom bug.
Okay.
Huh? Has nothing to do with your knowledge.
Okay. Okay. So here we see the team works together, and I think we get most of our resilience from our team members and not just from our individual resilient makeup. So so during the COVID-19, many of us all over the world were applauded by our countrymen, and people were standing out on balconies and making applause to all the nurses and doctors, and we had great amount of recognition, more than we ever had before. However, even though society gave us great praise and applause to nurses and doctors, many nurses were asked not to come home, not to bring the coronavirus to their home. We were also asked not to come to social activities, or some of us felt that neighbors would take a distance from us, wave to us from afar, and move from us far away, or not to bring our children to school. So although we had a feeling of society was very much supporting us, individually, we felt social rejection. And there were some nurses whose families told them, don't come home because we don't want you to bring the virus home. So then we had to find some place for these nurses to live. So the price, we paid a high price for our professional obligation, caring for COVID-19 patients, decreased our general well-being, increased our loneliness, and increased our social rejection. So as a result of this dissonance, Israeli Society of Critical Care Nurses decided that we wanted to make a national survey to find out what was the level of social rejection in relation to our resilience and our general well-being in the Israeli ICU nursing population between October and December 2020, which for us was during the peak of the third wave. So the questionnaires were the social rejection questionnaire, resilience questionnaire, general well-being, a work and personal demographic questionnaire, and the survey was distributed via social networks of nurses living in Israel. So the highest rejection scores were from the question that my family fears that I will care for corona patients and I will come home and infect them. So this was our highest rejection, was from our family. And people around me after work hours to also strengthen me. This was our resilience about my work at the hospital during the pandemic. So there, at one side, our families didn't want us to come home, but on the other side, we had lots of praise and support from people. And the highest resilience score was, I tend to bounce back quickly after hard times. And I think that is a characteristic of ICU nurses, that even though we, at the end of the shift, we can be at the lowest of our low, but we bounce back very quickly. And almost 46% reported being very low or in low spirits or feeling up and down. And 71% reported feeling extremely or very much depressed. And 54% were totally worn out. And in the regression analysis, we found a weak statistical significant correlation between general well-being and the resilience. So the higher the general well-being, the higher our resistance. There was a connection, association between feeling good about ourselves and being resilient. And there was a weak significance between social rejection and resilience. And resilience was not found to be moderate, a variable which was a moderating variable between social rejection and general well-being. So it doesn't really matter what the level of our resilience is, it will not affect the feeling of social rejection and general well-being. Limitation to this study was that we had a very little control over the recruitment, as it was a snowballing sample. So we don't know if we really captured a sample that would reflect most of the nurses. And therefore it's difficult to take our results and generalize to the whole nursing population. And the time that we distributed the questionnaire was at the peak of the third wave, and maybe that caused nurses were too tired to participate. It was after 2 previous waves and nurses were really, really worn out. And also in our country, there were many, many parallel studies going on at the same time. So that decreased the potential for nurses to participate. We are sick of answering questionnaires. And we believe that during the first wave, the feeling of loneliness and rejection and low general well-being might have been much, much more severe, but we didn't collect data at that time. And also we knew much less about the disease during the first wave. So the feeling of uncertainty was much more severe. So our conclusions are that the level of resilience is related to the level of well-being, and nurses not working in COVID-19 wards might have higher levels of well-being and less social rejection compared to those nurses working with COVID-19 patients. And social rejection was felt by many nurses, as shown by an inverse relationship between the closeness of the relationship and the sense of social rejection, and a high level of loneliness and depression. And the higher level of social rejection and lower well-being were found among nurses working on COVID-19 wards, as opposed to those who did not work with COVID-19 patients. And general well-being was found to be exceptionally low during COVID-19. And I think that this is what we're here for today, is to talk about how we can take care of each other and not get to such a low general well-being feeling in the next pandemic, or how we should, what lessons should we learn from this pandemic? And so how should we take care of ourselves? And I think number one is peer support, and we need to look after each other. We need to really connect with one another in order to see if we can help our companions. And we should be buddying with the more experienced nurses should be taking under the wing those nurses with less experience. And I know in our country, as in many, many other countries, we ICU nurses were working with nurses who were not ICU trained together in the ICU, and we were terrified working with them, and yet we have to support them. So there was more of a burden on us than in regular times. Nurses and healthcare assistants, we need to benefit in engaging clustered discussions to check on each other's well-being. And we have to really support and enhance team cohesiveness between the colleagues and vertically between our leaders and our teams. So there's a type of therapy called cognitive processing therapy, and it's a form of cognitive behavioral treatment, and it helps victims of trauma. And I really believe that nurses working in COVID-19, we really did undergo some trauma. And there are 4 main steps, which include education, information, honing and developing skills like proning and all the other things that we developed very much during COVID-19. And we have to change our beliefs. And how do we take care of ICU's nurses during the pandemic? What does the literature say? And I think that the beginning, the literature, and it was very difficult for us to take care of patients when we didn't have the family members with us, when the family members were kept away from the ICU. And once we opened the doors to the ICU with us, it was already in the second wave, the family started coming in. We felt a great relief that we were also with the family members. And I think that helped us to cope better. We need to really make sure that we have sufficient break time and food packages. And all this happened after the first wave, where we really didn't know how to handle the amount of break times we needed. And we didn't schedule the break times in my hospital. I know in other hospitals, they did different 2 hours on and 2 hours off. But in my hospital, there wasn't sufficient break time. We need the administration to acknowledge all of the work that we've done. And also from other studies, we know that the public are not acknowledging, the public and the media and all the nurses that were on the television all the time and were interviewed. This gave us a huge sense of pride in what we were doing, and it really helped us build our self-esteem and self-confidence. So this is just pictures of people standing in different countries. This is France and Spain and Israel, of the public standing outside on the balconies and clapping for all the nurses. So in summary, each nurse has a personal responsibility to seek ways in order to keep herself resilient. And also the head nurses have a responsibility to keep us and her team safe and strong, as well as the administration also has a responsibility to care for us. And that's my last slide.